Hello, everyone. This is Singing Lisa. Welcome to another episode, another podcast. It's the Focus Podcast, and I'm very excited to have Dr. Shiva AKULA as my guest today because he is the reason we were here in the beginning learning all about COVID-19 and what it all meant to the world, really. He introduced us to its definition, which we'll ask him again. And of course, he's got great news for us because we have learned a lot in the last 3 to 4 weeks. And so, Dr. Akula, welcome, and thank you so much for joining me today.
Thank you, Lisa. I'm honored again to share this information. A lot of people already hooked on to internet and already know quite a few things in bits and pieces, but I want to synthesize and put in a concise story. We have come a long way since November of 2019, where COVID-19 is a viral infection or a coronavirus that started in city of Wuhan in China and has spread all over the world. There's hardly a few countries that are remaining that do not have this virus infected people. Unfortunately, the numbers, global numbers, are creeping up very close to 2 million right now. And the good news for America is that a third of them are in the United States, but they are coming down day over day. The new cases are steadily coming down, so is the death rate. And the good news is perhaps it is a natural course, or perhaps all the social isolation, hand washing, social distancing that we are doing, or perhaps the treatment, or a combination of all. In any event, I think we are making a tremendous progress in the natural course of this disease.
Yes, I do agree. I believe that all of us have become instant students in more ways than one as we have listened to the news nonstop and learned everything and listened very closely to all of the new words that we've had to add to our vocabulary. And so it has definitely been a lesson for life in the last month or so. And then even learning that, we may not know exactly, well, close to when it got started, but just realizing how vulnerable I think we are, really not realizing that sometimes we're surrounded maybe by something that can be dangerous for us, but we've learned to, I think, have better hygiene and take better care of ourselves in the community. And I believe it's a lesson that has taught everyone and made us aware of other people and how to respect the space that we're in. So now we have learned that we have this disease that is out, that is still so very much a very strong fight. And hats off definitely to you and all of the people on the front line, our first responders who are continuing to save lives and work around the clock to make sure that there is an answer that we may not know yet, but that whatever you have at your disposal is being used to save lives. So we do appreciate all of those efforts. Now, we know that in the interest of learning how to take better care of ourselves, we have learned a lot about self-medication. We've learned about the medication that you all have access to or that you're developing as far as vaccines. So talk us through where we are. First, the question is, by now, is there a cure?
There is no cure for coronavirus COVID-19, but there are treatments available. So I'm going to split that treatments into four different categories. The first one is the antivirals. The antivirals, so this is actually in the test tube, these are the virus killing drugs. And most promising of that is perhaps the only one that has reached a very close stage of perhaps maybe getting approved is Remdesivir. It's manufactured by Gilead company, and there is so much information about this Remdesivir. I'll just briefly summarize that this is started as a antiviral medicine during Ebola virus, Ebola epidemic. Unfortunately, it wasn't a perfect a treatment option at that time, but they re-challenged with COVID-19 and they found it is more effective. And there are so many trials that are underway of different aspects of COVID infection. One of the important piece of information that just came last Friday is that they have actually reviewed the use of this drug in the expanded access treatment plan, or a compassionate use of this medicine to those who are sick and dying, and they have found about 3/4 of them got better. So this is the information that we have, but nevertheless it is really not a scientific study. It's an observation of a group of patients that received intravenous remdesivir with a fairly good outcome.
And so this particular medicine is one of several, as you said, that have been tried. What is so positive about this? What has this medication done that's given the best results?
In the sense, I wouldn't say it's the best results, but so far it has not been negative. It has been very helpful in treating symptoms of 3/4 of the patients that received in the United States on an expanded access treatment. And from what I understand, that globally there are several studies, scientific studies, which are required to get the FDA approved for this drug, and they are coming close, and it is not very clear how far we are, but we are hoping that some information is going to be out there this month of April. And unfortunately, I think the stock market reaction of Gilead company has not been good, despite supposedly a good news of this 3/4 of the patients getting better. Perhaps a lot of these evaluators of the company or the news are also medical people. So they know something that which may not be a great future option because of either the cost or the amount of significant benefit that you have from this drug. And also you need to understand these are intravenous drugs. It is not a pill form available, so it's got a lot of technical details in it. So somehow the response from the investment community or the business community has been very tepid.
Maybe cautious.
Maybe very cautious.
Yes. Well, understandably so. When it comes to money, that seems to be what's wrapped around so much of what we can depend on.
Yes.
And what we need so much of.
Yes.
And it's unfortunate that it goes in that direction. But of course, we know that the finances are needed to produce even what medical supplies are lacking, which has been a part of the problem with so many more people getting sick and exposed because of the lack of equipment, the PPE that's needed in every single environment that requires care for someone. So obviously that is definitely something to pay attention to. But prayerfully, as you said, this is something that is giving a positive result and response. And so could it lead to a better medication? Could it just be the first of something that is better to come?
There are a tremendous number of medications being tried. And the next one, which may have some hope, is the immune boosters. Literally on Facebook, I was told that there's 20,000 people registered that are positive, infected and positive, are willing to donate their plasma.
And what is the benefit of that?
It actually, you have the antibodies that they have developed on those infected patients that have recovered.
Okay.
So there's a protective antibodies. So they take the protective antibodies and inject into a patient who's sick. And evidently there's a small section of 5 patients in New York, and maybe some other use has resulted in a very good outcome. So this actually dates back to a story that I need to share. The serum therapy dates back to a big global problem of diphtheria. Diphtheria is a very serious condition, sometimes fatal, invariably fatal if it's not treated. And at that time, what happened, this was before penicillin was available, so diphtheria was treated very similarly by taking the serum of the infected patients and putting it in the active infections, and they found some excellent results. So what happened is, instead of trying to transmit whatever the infections the donor has to the recipient, they actually developed monoclonal antibodies, the antibodies artificially in the lab. And that's exactly what they are planning with Regeneron is a company that's actually manufacturing in the lab, and these are antibodies that they're going to generate, which are artificially, synthesized, and should be able to be given in a large scale. I'm not sure what is the timeline, but it is not going to happen right away.
An important message from the AKULA Foundation. If you or someone you know need to speak with someone who can help you during this difficult time as a result of the coronavirus, please call 504-418-0791. AKULA Foundation, founded in 1994 by Dr. Shiva AKULA, is the nonprofit foundation of Kanon Hospice Foundation. Originally dedicated to providing hospice care to the indigent community, the vision and mission of the AKULA Foundation envisions recovery from grief and loss through innovative programs for the community, providing compassion, professional support, continuing education, remembrance therapy, chronic illness, and palliative care services. Individuals in Louisiana and Mississippi, as well as patients and families of Kanon Hospice, also benefit from these services and more. More information about other programs providing great benefits, such as Camp Swan, a children's bereavement camp offering 3 yearly gatherings, grief support, continuing education, and advanced illness management programs, can be found at www.akulafoundation.com. AKULA Foundation can also be found on Facebook at AKULA Foundation and contacted at 504-818-2723. The AKULA Foundation relies on donations from the community. Consider AKULA Foundation in your next tax-deductible donation, online or by mail. The AKULA Foundation is available for you. Let's get back to more of the Focus podcast.
The Regeneron company has manufactured antibodies which are protective, and they will be available for study. And once those clinical trials are finished, then it would be available for approval by the FDA.
Well, that's always encouraging to know that there is another medication, which I think happens after you develop one. Then there's something else that people continue to study and find out, and then things get better and better as we keep looking for the answers to this very unknown disease. And so the other medications that are out there, I think, is there still a vaccine trying to be developed? Because that takes the
Vaccine would be the
longest?
last thing, because it is going to take months of trials, and that'll be perhaps the best solution. But in the meantime, they've actually looked into existing medications. And one of the important ones that I would like to talk to you about is Plaquenil or hydroxychloroquine. Hydroxychloroquine used for years and years and years. Actually, there is a story of how indigenous people used to have ceremonies of people that are sick and with a fever, that they would go through their ceremony, and eventually the patient would dip in a water of small lakes, and then they would get better. And it was found out scientifically that these small lakes have been right next to cinchona trees, and the bark fell into the water. So the water was full of cinchona, from which the chloroquine is derived. And so the chloroquine is a lifesaver for malaria, and malaria still is a big problem throughout the world. And chloroquine being a little bit more toxic, they've come down with hydroxychloroquine, which is a derivative of chloroquine, with 40% less toxicity. Now, in terms of the cost, the timeline is already there. It's available. So you don't need to wait for it. Do we have studies? There are some studies, but not to fulfill the criteria, strict criteria of the FDA. Just to give an example, hydroxychloroquine has been used in patients with rheumatoid arthritis and other rheumatological problems. So they have actually looked at a few hundred patients that have been taking Plaquenil, and they have only found out about 10 to 15 patients that are turned positive with COVID.
Mm.
So obviously there is some protection that they have. So it is an observation among all these patients that have been taking hydroxychloroquine or Plaquenil for a long time. There are other studies that have been kind of equivocal, but they have not done a randomized clinical studies, which I believe are in progress. But this is very cheap. And from what I understood with after President Trump touted as the game changer, especially combined with azithromycin, this was available when I last checked with the pharmacy was 32 cents a pill. So you're looking at a 10-day course of treatment to cure or to treat COVID-19.
Wow.
And if remdesivir is approved, we're looking at least 40, 50,000 for one treatment.
Mm.
So could you imagine if the rate at which it's going to spread, and especially if it spread to Africa, where they hardly have any resources, they're looking for, hydroxychloroquine, which may not be the perfect, but there's something to at least to get by, rather than, remdesivir if it turns out to be the best one. So this is one of the important things. And a lot of times people talk about chloroquine as toxic to the heart, or it can cause some blindness. I've actually trained in India and then also have a couple of years of ophthalmology experience. I have not seen a blindness causing from chloroquine. So obviously this is not that common. It is very rare, and it is used in a long term, and those are the people that will get it. And this treatment that is being offered is only from 5 to 10 days, not more than that. And in India, their Indian Council of Medical Research, which is equivalent to National Institute of Health here, has now approved for the healthcare workers to take like 2 tablets first day and 1 tablet every week for 7 weeks, as long as they're caring for the patients.
Wow.
And the people that are exposed at home, they are recommending 2 tablets first day and 1 tablet once a week for 3 weeks. So there is a tremendous amount of information, and it's been fairly well tolerated. And in India, it must have been used for several million patients for malaria. And I have not come across the serious side effects. But if somebody already has arrhythmia or some blindness to begin with, then or a retinal damage, then it does not make any sense for them to be challenging themselves with Plaquenil.
That is a lot of great news. It's very promising, and I'm sure everyone would vote for that medication because of all of the benefits, really not just financially, but to everyone who's involved and surrounded, because you've mentioned every single aspect of people who have been touched and affected by this disease. And so that would really be life-changing and saving for so many people. So we'll be watching and continue to hope that that turns out to be a very big benefit. Now, you wanted to speak as well about the immune system, and we all are trying to figure out how to boost that immune system, and we all have our home remedies and our everything we've learned and heard about and tried. And so what do you suggest and recommend?
I do not recommend any of the
I thought I could get a doctor to do
therapies,
that.
no, but people have used turmeric, which is Indian spice powder, and that is supposed to be anti-inflammatory and very beneficial. And neem leaf powders have also been beneficial. And people have used high-dose vitamin C. Generally, we use like 500 milligrams twice a day or something, and even a higher dose, is being recommended. But there's no studies. Actually, as a matter of fact, I was talking to Dr. Maria, who hopefully, might want to talk about, all these natural supplements and all this stuff. Zinc also is another thing. But there is some mention of zinc along with hydroxychloroquine or Plaquenil seems to have a better effect or a better outcome. So there's something, it seems to be zinc and Plaquenil seems to have 2 different site of action. So that would be one. All in all I can tell you is there has been several uh, supplements, treatments that they're claimed as the cure for COVID-19, and FDA has got hold of quite a bit of those false claims, and they have given serious warnings to them. So it's very, very important because the people are vulnerable, they're afraid, they're panicky, and this has started as something that maybe it has come to wipe out the humanity out of this planet, and now we are slowly reconciling, but there's a lot of fear, and people want to do anything to take care of their lives. So it is been reported there's been a lot of scamsters that are trying to claim that there is a cure or there's a better treatment. So they really don't want to go after those kind of treatments. So it's very, very important for the community and the whole country to understand and report if there is anything that is suspicious and potentially a false claim. There is nothing wrong in calling FDA or any state authorities to find out exactly what's the truth.
Yes, this really is a time where, as I said before, that everyone is becoming more educated and understanding the process. And what I really appreciate about it is, we probably everybody wasn't interested in science or in learning about anatomy, but we've definitely gotten a lesson repeatedly about how the body is working and what happens when this disease enters, the body, and how that process works. And then the other thing that's interesting is you also mentioned that there's word going around about the NSAIDs, and that's the non-anti-steroidal medications that people are used to. Would you speak to that? What people commonly know as that?
At this present time, with the information that's available, NSAIDs are a group of non-steroidal anti-inflammatory drugs like ibuprofen, Motrin. They are supposed to be not used during COVID infection or potential COVID infection. And there's another one, which is the steroids. Not the topical steroids, but something that they take by mouth or by intravenous injection. Evidently, the people that are sick, that have received steroids, systemic steroids, or by IV form, that their mortality is increased. So this is something very, very, very important to note, that the non-steroidal anti-inflammatory drugs and the steroids are no at this present time. They also talk about, there are class of medicines for blood pressure called ARBs and ACE medicines, which are good for the blood pressure. There is not a lot of information available at this time. Recommendation is to continue taking those because high blood pressure is one of the underlying comorbid condition that can deteriorate somebody who's got a COVID infection. So they want to make sure the high blood pressure, diabetes, these things are very controlled.
So, in general, are we telling people that even though there is not one decision on all of the things we've heard, the best thing overall in taking care of yourself and your immune system is eating and taking the medications or what has been proven to work and to support a good, healthy body? That's the best way and the safest way to go so that we can generally have a good immune system, which we've learned is how you actually have a better chance of fighting the disease.
Yes, in terms of flu, patients can take Tylenol, plenty of fluids, maybe a chicken noodle soup. And but if for some reason, if that flu appears to be associated with shortness of breath, that would something should knock you